Good day, my name is Adrian Raine. I'm Professor of Criminology, Psychiatry and Psychology here at the University of Pennsylvania. I specialise in the neuroscience of crime and violence, psychopathic personality. And today in the next hour, I'm going to be talking about the challenges that a new discipline brings to law, society and ethics. That new discipline is neurocriminology, the neuroscience basis to crime and violence, using neuroscience tools to try and understand the causes of crime and also the ultimate treatment and prevention of criminal behaviour. Some of the new challenges that I'll be talking about today are caused by the fact that the new subdiscipline of neurocriminology is controversial, a biological base to crime and violence. That's a little bit new and quite different to the traditional sociological perspective that people have had on the study of crime. So some of the challenges are made more poignant by this new discipline. It's slightly controversial, but some of the challenges that we'll talk about today are really old ground. They're nothing new in terms of the challenges that I'll be discussing. We've had them before, but somehow the biological approach to understanding the cause of crime makes it a little bit more tense. It adds a little bit of controversy to what are usual ethical challenges in neuroscience research. First of all, I'll give you a very brief introduction to what is neurocriminology, a neuroscience brain imaging basis to crime and violence. Secondly, I'll turn to the ethical issue of, well, what if we can predict crime much earlier in life than we've been able to by bringing on board neuroscience techniques, combining them with social processes to predict future crime? What are the ethical challenges there? Thirdly, I'll be looking at biological interventions for crime, the use of drugs to medicate children with aggression. To what extent does this pose ethical challenges for us? Fourthly, I'll be talking about the shifting ground of ethical values over time, by which I mean if you do longitudinal studies, which started, say, 30 years ago, when there was a different ethical perspective in place, to what extent does that research and those research findings become, quotes, unethical? To what extent should they be allowed to be published or not? What are the controversies that occur there? And how are we going to deal with that? And very lastly, I'll turn to the issue of responsibility, punishment, and free will. If we begin to use brain imaging techniques to understand the causes of why people perpetrate violence, to what extent is this creating ethical challenges in the courtroom? And how are we going to deal with that in the future? So that's the layout. Let me turn very briefly to give you a brief introduction to neurocriminology. Now, in a way, the father of criminology was this man, Cesare Lombroso, an Italian working in hospitals, prisons in Milan back in 1870. And he was fascinated by medical biological measures of what he called criminal man. And he was doing an autopsy on a famous brigand called Villela one cold November morning when he experienced an epiphany. He had a revelation looking into the skull of Villela. And what you see here, in his words, are the impression that struck on him. He saw, in a flash of light, as in a vast plain under a flaming sky, the problem of the criminal offender. He saw a brain basis there to crime. And he argued that, in a way, criminals are an evolutionary throwback to primitive savages. He argued that they are low down on the evolutionary hierarchy. He actually created a hierarchy where people from the north of Italy were on the top of the evolutionary hierarchy, and at the bottom were criminal offenders and also people from Bolivia and Peru. He argued for a brain basis to crime. He argued that criminals are an evolutionary throwback. I don't believe that latter point. I don't believe criminals are an evolutionary throwback, but I do believe that he was partly right in arguing for, in part, a brain basis to crime. These are the atavistic stigmata that he identified in criminal offenders in Italy: the sloping forehead, the aquiline nose. And of course, it sounds a bit ridiculous in many ways, but not all of his work was entirely off the mark. Here's another atavistic stigmata that he argued would mark out criminals from other offenders. Most of us have two palmar creases. If you take your palm and flex it, like mine, you'll probably see two palmar creases. But criminal offenders, according to Lombroso, had just one palmar crease. This to him was the mark of Cain. Another mark of Cain was a big gap between the first and the second toe. Maybe later you might like to check that out to see if you have that mark of Cain. Sounds absurd, sounds ridiculous, but actually these indicators, these atavistic stigmata, are actually minor physical anomalies which we now know indicate a disruption to fetal development sometime at the end of the first trimester of pregnancy and also at the beginning of the second trimester of pregnancy. And the indicators of that brain maldevelopment are things like low-seated ears, single palmar crease, abnormal head size. And several research studies have shown that criminal offenders have more minor physical anomalies. So Lombroso, the father of criminology, was partly right in arguing for a biological brain basis to crime. But he was very controversial. He was very controversial. And very quickly, by 1910, 1920, he was totally discredited. And that has left a mark on more recent modern neuroscience research on understanding the causes of crime, which still remain and keep this discipline controversial. And when we get into the ethics, you can begin to see we have a foundation which is quite different to the study of other conditions like schizophrenia or depression or manic depression. Are we born bad? Lombroso thought we were. That's an old question, but from this new US News and World Report series, we can see this is still a question that burns in our minds here today and raises controversial issues. Quickly to some of the science. For example, we did some brain imaging research showing that 41 murderers compared to 41 match controls have much poorer functioning in the frontal cortex. That's a part of the brain, as many of you know, that's involved in controlling and regulating emotions like aggressive behavior. If you like, it's the guardian angel on our behavior. When we get angry, when we get upset, we have usually enough prefrontal regulation to be able to control our aggressive impulses. But if you're lacking the lid on the Pandora's box, if you are lacking good frontal functioning, as we see here in the murderers, then that can result in disinhibited impulsive aggression. Now, of course, the neuroscience of crime and violence is extraordinarily complex, and we're only just beginning to parse out what type of offenders may have poor frontal functioning. So you can see this one-off offender has poor frontal functioning compared to the normal control. But not all murderers are the same. One offender in our sample killed 64 people in a 12-year period without being caught. His scan is shown in the middle. He has excellent frontal functions. And that's the exception that proves the rule, because this is a man who could clearly plan and regulate his behavior without being caught. How could he do that? He had good frontal functioning, allowing him to plan and regulate. So it's not one size fitting all. There are a lot of scientific complexities to understanding the neurobiology of violence. But the message here is we're beginning slowly to make inroads into understanding brain predispositions that can lead one into violence and crime. We divided our murderers up into those who were effective, impulsive, emotional murderers. And as you can see, that's the group that has the poor frontal lobe functioning there. Whereas people who plan and regulate, like that serial killer, they actually have good frontal functioning. That's group data on a set of individuals that we studied. But we can take this to the individual level, to the courtroom. What about individual violent offenders, murderers who kill? And what about their frontal lobe functioning? And can that potentially excuse them from a more heavier, severe punishment? Well, one case is Herbert Weinstein. He was a 65-year-old professional living in Manhattan. It was January the 7th. The 12 days of Christmas was over. He was with his wife up on the 12th floor of their Manhattan apartment. They'd both been married before. They began to discuss each other's children and began to disrespect each other's children. That leads to arguments, that leads to fights. What does Herbert Weinstein do? He withdraws from that, goes to another room. His wife follows him and attempts to scratch him and attack him. His response to that is to strangle her, kills her. That doesn't look good, so he opens the window and throws her body out 12 floors so she lands on the street to make it look like an accident. He attempts to escape the building, but police apprehend him. He's caught and is charged with homicide. Now, his defense team were astute, and this man had no history whatsoever of any aggression or violence, so they did a brain scan on him. And you don't have to be a neuroradiologist or an expert neuroscientist to look at his brain scan here, the structural MRI scan here, and the functional MRI scan on the right, to draw the conclusion that his brain may not be entirely normal. And in fact, it wasn't a normal brain. He had a cyst growing in the prefrontal cortex, squeezing the frontal cortex and also part of the temporal cortex. And that's what you see here. His defenders argued that he was not fully responsible for his actions, and there was an agreement whereby he would only serve 7 years in prison as opposed to a minimum of 25 years. Now, another different case is the case of Kip Kinkle. That didn't quite work out. This was a boy who killed both of his parents and then went to school trying to kill as many people as he could, succeeding in killing 2 students and injuring about 20 more. The defense also testified that he had poor frontal functioning. This is the SPECT scan. Here you can see holes in the prefrontal cortex. You're looking underneath the brain, looking up through the brain. This is the front of the brain here. This is the anatomy of the brain here. This is the ventral prefrontal cortex. You can see holes there. So again, the defense would argue he's not fully responsible for his actions, a controversial issue. That didn't work in the case of this 15-year-old killer who's serving 111 years in prison without the possibility of parole. So these issues come in. To what extent should we use neuroscience findings on individual cases in a court of law like this? That's an issue, an ethical and neurolegal issue that we'll return to a little bit later. Let me turn to ethics, let me turn to moral decision-making. When we are weighing ethical issues, as you do in this lecture series, we make moral decisions. And it's appropriate to ask ourselves, when we are doing that, what areas of the brain are being activated when we are weighing, for example, risks versus benefits in neuroscience research? Well, this is the type of dilemma that would be given to normal people in a scanner to work out what's the neural circuitry underlying moral, ethical decision-making. Imagine yourself in the scanner with this dilemma being posed to you. A runaway trolley is headed towards 5 railway workers who are going to be killed. You're on the footbridge here, standing above the railway tracks. Here's the 5 railway workers, here's the runaway trolley. Standing next to you is a large gentleman. Now, the only way that you can save the lives of these 5 men is to push the large gentleman off the bridge. The stranger dies, but the 5 workmen will be saved. The question for you, and the question I want you to answer and to think about right now is, would you do it? Is that appropriate? Think through that now. You must give a response. You can't sacrifice yourself. You can either push him off, kill him, save 5 lives, or you stand there and watch 5 innocent men die right in front of your eyes. What would you do? About 80% of us would do nothing and we would watch those 5 men die. About 15 to 20% of us would push the man off the bridge. That's utilitarian moral decision making. The issue is really not what you chose, whether you chose to push him off or not. The question I have for you instead is, how were you feeling during that moral dilemma? And if I'm correct, I think you would feel at least slightly uncomfortable. You're not even on the bridge with him. This is hypothetical. But even when it's hypothetical, you feel awkward, discomfort. My intuition is that emotion is flowing through your mind and your body in contemplating that moral dilemma. Now, hold on to that issue about emotion. I'll come back to that in a second. But what brain areas are being activated when we make ethical moral decisions? Well, research has shown us it's in part the medial prefrontal cortex, also the posterior cingulate, also the angular gyrus, and in addition, the amygdala. The amygdala is, of course, as many of you know, very much involved in the generation of emotion. So perhaps the amygdala is being activated during these moral decision-making tasks, in part because emotion is a very important component of moral ethical decision-making. Now, that's in normals. What if you put a psychopath in the scanner and give him the same dilemmas? What brain areas would be activated in a psychopath who, as you know, is a very immoral individual? They perpetrate serious crime and harm to society. Well, what my graduate student, Andrea Glenn, has been showing is that psychopaths compared to normal people show much poorer functioning in these very brain areas. The amygdala, the posterior cingulate, medial prefrontal cortex, angular gyrus. So they may give the right answer to us in terms of would they push him off or not. In fact, they do. They give the common answer, no, I would not kill that man. But the brain areas that normally underlie that moral decision are just not functioning in these psychopaths. And so the question, and really the ethical dilemma that I think this brings up is, yes, cognitively, criminals know right from wrong. That's the question that law courts ask. But should we be going morally and ethically beyond that question to ask the question, but do psychopaths have the feeling of what is right and what is wrong? Because if you lack the feeling for what is right, maybe you will do wrong. And perhaps you are not responsible for being wired up neurologically to not have that moral circuit being activated when posed with a moral dilemma. I'll be coming back to this issue right at the end of this talk. Now, let's turn on to some other issues here. That's just an introduction in part to the brain basis to crime and violence, neurocriminology, the study of the neural basis of crime. It's given a hint of what's going to come a little bit later when we get into a discussion of neural law and the challenges, ethically and moral, that are being posed there by the new discipline of neurocriminology. What I want to turn to is a different ethical issue, and that's the issue of what if a time comes when we can predict pretty early on in life which young children are going to grow up to become violent, murderous, raping psychopaths. Should we do something about that early on or not? Let's move into this slowly here. I'll introduce another study, a structural brain imaging study, where we took men from a temporary employment agency in downtown Los Angeles, and we assessed them for whether they were normal, whether they just had alcohol and substance abuse and dependence, or did they have antisocial personality disorder. If you're not familiar with that term, antisocial personality disorder, it's a clinical disorder. Translate that into lifelong criminal offending. Your life course persistent offender is essentially what we are dealing with here. These people have high scores on the psychopathy checklist. In fact, if you ask these men what crimes have you been committing recently, then you see 43% have raped someone, 53% have attacked a stranger causing bruises or bleeding, armed robbery 29%, fire gun 38%, and 29% had either attempted homicide or they had completed homicide. Now, they weren't caught for those offences, not the severe offences. About 50% had been caught for some offence, but half had never been convicted. Never been convicted. By the way, here's a research ethical question in this field. I know that some men coming into us, these free-range violent offenders in the community who are around there perpetrating violence, they come for 3 days for research. I interview them and I say, well, what crimes have you been committing? And they say, well, you know, I committed homicide or I've attempted homicide. What do? I just let them back out into society to do what? To attempt homicide and potentially to complete homicide. And you may ask me a pertinent question: how moral and ethical is it of me as a researcher to do that? My response is that I have a certificate of confidentiality protecting me from being subpoenaed by any law enforcement agency in the country. In other words, these individuals were fully able to talk, perhaps for the first time in their lives, about what violent criminal acts they had perpetrated, knowing that it would never go anywhere. It's almost like a father confessional in a way. That's why I believe they spilled the beans to us. And technically, it would be illegal of me to release that data to any law enforcement agency. So that's my defense for standing by, letting these people come in and out and doing absolutely nothing about it. But I think ethically you could challenge actions like mine and other researchers in these situations. But that's not the point I really want to make here. A research point, and then I'll come on to the prediction point. If you look at these people with antisocial personality disorder and you scan their brains and look at the amount of grey matter in the prefrontal cortex, which is coloured green here, then the antisocial group show an 11% reduction in the volume of grey matter in the prefrontal cortex. Their brains are structurally, physically different from the rest of us. That crazy Lombroso, that 19th century medical doctor, was actually right. And if their brains are very different from us, a question again that we'll turn on to later is, should we punish them as harshly as we do? The point I want to make here is a prediction issue. As well as showing a reduction in prefrontal grey volume, we also measured their sweat rate and heart rate during a social stressor. And these psychopathic antisocial people are literally cold-blooded. They give reduced skin conductance and heart rate responses to a social stressor, which is maybe part of the reason why they are fearless, cold-blooded individuals who perpetrate violence. If you take those three simple biological measures, put them together and try and predict who is a control and who is antisocial, where 50% is your chance accuracy, then these three measures correctly classify 77% of the sample. Now, instead of doing that, well, what have criminologists done in the past? They've used classic social societal measures to predict to future crime. Things like parental crime, low social class, abuse, institutionalization, divorce. Now, if you just do that to predict who's antisocial and who's controlled, you are correct 73% of the occasion, and that makes perfect sense. Now, the key point I want to make is this. Now add into the prediction equation three quite simple neurobiological measures, and that correct classification goes from 73% to 88%. That's relatively high. It's not perfect prediction. And in fact, this is really just a heuristic point. I mean, this is a small sample. Findings like this need to be replicated, extended. But the point I'm making is that with the new discipline of neurocriminology, if we begin to add biological measures into the prediction equation, will we, in the next 10, 20, or even 30 years, be much better at predicting which individuals out there on the streets right now are walking time bombs for homicide and violence? And the question comes, should we be doing something about it right now? How early in life can we predict to future crime? Well, there are classic social measures, even behavioural measures. A child who's aggressive at age 8 is much more likely to become a violent criminal offender. We already know that. But of course, some kids who are aggressive at age 8 burn out of their aggressive behaviour. It's not perfect prediction. Let me give you a recent finding from our laboratory which begins to raise a question of perhaps in the not too distant future we may be better placed to predict early on in life who becomes criminal and who does not become criminal. This is a study by my research associate Yu Gao. It's on fear conditioning measured at age 3 and crime at age 23. It's just been published. Now, I think you know what fear conditioning is, as neuroscientists. Pavlov's dog's ability to associate events in time. In Pavlov's dogs, the ability to associate the sound of a bell with food. That leads to the conditioned response of salivation. Well, in fear conditioning, it's very similar. Some stimuli out there are predictive of a negative outcome, and we generate an emotional fear response if we have been able, through our past history, to associate a certain stimulus and a certain event with ultimate punishment. So, for example, if I think of, robbing Bank of America up the street here, I may think about it. I may think, yeah, maybe I could pull that off. But if I think hard about it and think about doing it, my heart pumps more, my hands get a little bit clammy. Why? Conditioned emotional responses. I have learnt through the process of classical conditioning that certain stimuli, events, thoughts, ideas, bad ideas, are associated with punishment. And so what stops me robbing Bank of America or 7-Eleven is these conditioned fear responses. Put another way, we think that criminal violent offenders are lacking fear. They don't have the normal fear responses that we have that hold us back from aggressive antisocial acts. I don't fight other people because I'm frightened if I do, I'll get my nose broke. But if I lacked fear, I might be more likely to get involved in a fight. So the idea is that a lack of fear may predispose to crime. And there have been a lot of studies showing that convicted psychopaths, violent offenders, have poor fear conditioning. And we measure this in the laboratory using electrodes, using skin conductance, using a classical conditioning paradigm, which you'll be, I think, familiar with. What we did here, and this is when now we moved from the lab to the community almost, we assessed 1,800 3-year-old children on fear conditioning. They were age 3, every kid born in 2 towns. Every kid born in 2 towns in 1 year were brought in for an assessment of fear conditioning. A whole community screening, if you like. We then followed them up for 20 years. At age 23, 137 of them had committed a criminal offence. We looked at court convictions. We then matched them. This was a case-controlled design, carefully matched 2 for 1 with controls who were not criminal offenders. What our findings showed is that the normal controls, the blue group, they condition well. They show a bigger skin conductance response here to the CS+. The CS+, if you're not familiar with this, that predicts the punishment. The control stimulus, CS-, does not predict the future punishment. The criminal offenders do not show this differentiation between the CS+ and the CS-. They do not condition. The normal controlled do condition. Now, that's just one measure, but this study shows that to some degree, it shows that your ability to condition at age 3 is, to a limited extent, predictive of future criminal offending. One swallow doesn't make a summer, that has to be replicated, extended. But the heuristic point I want to make is we are increasingly beginning to find early factors that predispose to crime and violence. Another example for you is we did a study of 4,000 children measuring birth complications at their birth, and combined with maternal rejection, the mother not wanting them in the first year of life, that allowed us to not predict to violence 30 years later, but those with the double whammy, the biological deficit with the social deficit, they were more likely to have a criminal conviction 30 years later. So that's taking birth data and social data in the first year of life, putting them together, looking for interaction effects. So more and more I'm beginning to think that neuroscience research on crime and violence will begin, slowly but surely, to uncover the early risk factors that put some individuals at risk for crime and violence. And the ethical issue becomes, well, what are we going to do with this data? Some of you will have seen the Tom Cruise movie Minority Report, or a movie about stopping crime before it starts. Knowing ahead of time somebody is going to commit a homicide, catching them before they're able to perpetrate the homicide and lock them up. Science fiction, of course, but when will science fiction become reality? Not today, not tomorrow, not in a year, but 10 years' time, 20 years' time? How far away is Minority Report given the suggestive data I've presented to you? And that's just a tip of an iceberg of a lot of other research data that we have. So, for example, right now there's no national child screening program. And I'm not saying there should be, but let's imagine to the future. What if we suddenly decided, you know, enough is enough. We've had enough of crime and violence out there. We need to stop it before it starts. And we have a sense of what those indicators are. And we're going to implement a national child screening program where every 8-year-old child, for example, in school is going to be screened for all the risk factors, the social risk factors, the psychological, the family, the brain, the genetic. Putting all that information together, in the future, we will be better able to predict future violence. I'm convinced of that. Not perfectly, but we will do a better job. When will society stoop to the level of deciding enough is enough? And it only takes one headline in the newspaper one day to make society think, this is it. You know, it's gone too far. We need to act. That's the ethical dilemma that surrounds neuroscience research on crime and violence. And the other issue is, you know, you might say, that's outrageous. A national child screening program. Again, I'm not advocating that. But here's a scenario for you. But if we have the scientific knowledge to predict, isn't it morally wrong of us here, knowing the knowledge, not to do anything about it? Are we going to let lives be taken out there on the streets when we could have stopped it through, let's say, benign prevention programs early on in life? But of course, there are profound civil liberties issues here that we have to balance with the idea of protecting society and also allowing recognizing civil liberties here, especially with children. And one of those issues that I'm concerned with is, for example, the use of brain imaging. For example, you know, with increasing knowledge, we may be able to detect from brain scans when people are more likely to be at risk for future crime and violence. The concern might be, are we going to take brain imaging, genetic and other neurobiological techniques onto the streets and in a Minority Report scenario, start scanning everyone and locking up those individuals, for example, with a brain scan like this serial killer? I don't like that idea because my brain scan looks very much like that of the serial killer. And I would not want to be the first one to be rounded up and locked up after I had not committed any violent or criminal offence. But we also have to protect society. That's the counterpoint there. That's prediction. What I want to do now is turn on to the issue of interventions to stop crime and violence. And again, the point is, if we want to stop future violence, we have to start early. We can't wait until we've caught the offender, they're locked up. You know, interventions at that point may help a little bit. They're not effective at the moment. There's no wonder treatment for criminal violent offenders. I want to turn to the issue of using biological interventions to reduce aggressive behaviour in children. Why children? Because the aggressive little Johnny now at age 8 is going to be the violent psychopathic little Johnny, you know, in about 15 years' time. There's no destiny, of course. Lombroso was wrong on that, but there's a raised odds of some children becoming violent offenders in the future, and we know that aggressive behavior in childhood is one of the behavioral risk factors for future violence and crime. So, what about intervening right now with these children? This is a meta-analysis of 45 randomized placebo-controlled trials which have used drugs in children to reduce aggressive behavior. And in this meta-analysis, then these are effect sizes. If you're not familiar with effect sizes, it's the extent of the strength of the association between giving medications to a kid and how much does it reduce their aggressive behavior. An effect size of 0.8 is large. That's a large effect size. So, for example, if you give kids atypical antipsychotics, the effect size is 0.9, meaning it's really effective in reducing their aggressive behavior. The typical antipsychotics, the effect size is 0.7. Stimulants are effective, effect size of 0.8. Mood stabilizers are effective. Antidepressants, less effective, but still significantly effective. Now, these 45 randomized controlled trials were not just targeted on children who, for example, also showed psychotic behavior or also showed ADHD. It also included quite a number of trials where the presenting problem to the clinician was significant aggressive behavior. So what this research shows is that drugs can be very effective. And to give you a sort of reference point, cognitive behavior therapy is a, quotes, non-biological treatment. It's a therapeutic treatment. And the effect size there in reducing problem behavior in children is around 0.3. So compare that effect size with some of the much more substantially larger effect sizes here. If you turn to adults, there are far fewer studies of adults, but some studies show that anticonvulsants work with male individuals in the community who have an aggressive problems. There's also data showing that anticonvulsants are effective with prisoners with impulsive aggressive behavior. But the question is, to what extent should we use medications, a biological intervention, to reduce aggressive behavior in children? And there are different perspectives we can take on this from an ethical standpoint here. The question then, should we medicate children to reduce aggressive behavior? Let me give you one perspective. No, absolutely not. This is just unconstitutional. It's a wrongful assault on agency in that child. That in doing this biological manipulation, we're taking some essence, some biological God-given essence away from them, you know, without their control or authority on that. That's wrongful. That biological intervention to reduce aggressive behavior. Indeed, can't we take it further? Don't children have the right to rebel? You know, we're saying, you know, we're trying to stop violence by reducing aggression, but let's face it, isn't aggressive behavior sometimes assertive behavior in the child? The being themselves. This is how they are. That's produced by the families they live in, by society. It's naturally them. We are doing something unnatural in medicating them to reduce their aggressive behavior. Also, I will take this further. You know, this is going into that slippery slope of using medical techniques on a social problem. The argument I could give you is that aggression is a social problem in society. And what we are doing, we are artificially medicalizing a non-medical condition. Aggression and violence is not a medical condition. Schizophrenia may be, depression may be, not with aggression and violence. This is a societal issue. It's not a medical issue. It is not a biological condition that we should be tampering with. And also, if you medicate children for aggression, where is this going to end? The next disorder down is what is called in DSM oppositional behavior. According to psychiatrists, this is a clinical disorder. What is oppositional defiant disorder? It's just kids having some guts in, sort of not doing what the parent is asking them to do. It's just natural rebellious behavior. Some clinicians have the gall to put this in DSM, call it a disorder. The next thing we know from this biological research is that we will be medicalizing kids who just have some courage. Now that's one side of the perspective. I'm not saying I believe those arguments, I'm trying to give you a picture here. Let me give you the other picture. Today, most aggressive kids go entirely unhelped and untreated. They get no treatment at all. And yet we know that in being aggressive, they're putting their futures at risk, because we know aggression in childhood is a predictor of violence in adulthood. That's the issue. And if, again, we have the knowledge, we've got the research knowledge to show medications can be effective in children, why shouldn't we be applying them to children in society who have this problem? And indeed, if we use medications as a quick fix to make children non-aggressive and potentially more attentive, then perhaps that can potentiate and enhance the strength of social interventions like psychotherapy or cognitive behavior therapy, because the drugs, crudely speaking, may help fix the attention span and the brain processing of the child, so that in a cognitive behavior therapy, they can better take on board the lessons that cognitive behavior therapy is trying to give them in terms of reducing their impulsive aggressive behavior. So the meds combined with the cognitive behavior therapy may be very important. If we say no to a biological solution to aggression, aren't we saying no to future scientific advances? Also, you could submit that parents have the right to know what works and what doesn't work. When I saw that meta-analysis, I was quite shocked. I'd never heard of medications being so effective in reducing aggressive behavior in children. If I don't know, I'm pretty sure that parents out there don't know. I suspect also that other doctors, pediatricians do not know either. To what extent should this knowledge there must be greater, the community must be more aware of biological options for the treatment of aggression. So those are the points and counterpoints on this difficult, thorny ethical question of, do we medicate children? Now what I want to do is turn to the fourth part of this talk and talk about the shifting ethical values over time, by which I mean that over the course of 20 and 30 years, our ideas and judgments of what is ethical research changes. I want to give you a concrete example in a study that we did, which was viewed to be unethical. So this is the study. It's a study of children on the island of Mauritius, a small tropical island in the Indian Ocean. This is a study in which we assessed malnutrition, signs of malnutrition, in 1,800 3-year-old children. Now, the indicators of malnutrition were low hemoglobin levels, that's an indicator of iron deficiency. Angular stomatitis is cracking of the mouth or lips, that's riboflavin deficiency. Kwashiorkor is African dialect, it means orange hair. Children in Mauritius have black hair. Some of them have an orange tint to their hair. That's caused by dyspigmentation, a lack of pigmentation. And that's a sign of protein malnutrition. Also, sparse thin hair is a sign of protein malnutrition. So pediatricians, when the children came into the laboratory at age 3, they assessed these children for these indicators of malnutrition. And this was conducted in 1972. And it's important to remember that point. Then what we did is we followed the children up at ages 8, ages 11 and ages 17, assessing them on different measures of antisocial behaviour. We also assessed the IQ at ages 3 and ages 11 here. I'll show you the findings first, and then I'll show you what the ethical issue is. First of all, these are the findings on aggressive antisocial behaviour. The red bars are children with signs of malnutrition. The yellow bars are the controls, children who had no signs of malnutrition. This is age 8 data, age 11, age 17. This is aggression, hyperactivity. The red bars are always higher than the yellow bars. The kids with signs of malnutrition at age 3 are more likely to be aggressive, hyperactive, delinquent at ages 8, 11 and 17, right throughout childhood and adolescence. That's one of our findings. We also found that the kids with poor nutrition had lower IQ. So the more signs of malnutrition here, this is IQ on the y-axis. So verbal IQ is the blue line, spatial IQ or non-verbal IQ is the red line, total IQ is the green line. This group have no indicators of malnutrition. This group has one indicator, two indicators, three indicators. The greater the more indicators of malnutrition, the lower the IQ. We put these data together in a model and showed that poor nutrition at age 3 leads to lower IQ at ages 3 and 11. Why? Because of course malnutrition is going to be an indicator of some insult to the brain. The brain needs nutrition, of course, so we take malnutrition as a proxy for lower brain functioning. That leads to lower cognitive functioning, lower IQ, and the lower IQ leads to aggressive and antisocial behavior, either directly or indirectly. We were very excited with the findings. We submitted them for publication. We went, first of all, to a leading medical journal. We got 3 really positive and excellent reviews. The reviewers were excited by the findings. This was new and interesting, and they were, as far as one can read from the reviewers' comments, recommending publication. As I say, it was reviewed by an influential medical journal, a very influential medical journal. And this is what the response was from the editorial board of the journal. The editors were very concerned about the ethical problem of diagnosing children as having malnutrition and yet providing no intervention over an extended period of time. Point number 1, ethical point number 1. You did not intervene. Point number 2, in that regard, there is no mention of review or approval by an independent ethics committee or IRB. Now, in rejecting the article, no scientific issues were raised. This was the issue that was raised by the editorial board, leading them to reject the manuscript. So we responded with a 4-page letter to respond to these ethical points in terms of the scientific conduct of our research. Well, first of all, children with any significant medical problem, whether it was malnutrition or scabies or parasitic worms, they were referred to treatment. Unfortunately for us, that was documented, not recently, but 5 years after the beginning of the study in a publication by Brian Bell in 1977. So first of all, kids were being referred to treatment. Secondly, we are not diagnosing malnutrition. We are assessing indicators of malnutrition. We're not making a medical diagnosis. So if we are hauled over the ethical coals for measuring indicators of a medical problem, what about all the other researchers out there who are assessing indicators of a medical condition and actually not themselves intervening and doing something about it to remediate that problem? The third point we made in this long letter is that this study was carried out in 1972. In 1972, the prevailing ethical codes were the Declaration of Helsinki, published in 1964, and the Nuremberg Code. Nuremberg Code requires that experiments should be conducted by those who are scientifically qualified. We were qualified, or at least I didn't set up this project. My PhD supervisor set it up in 1972. I took over the project from him, but there was full scientific supervision. In the Declaration of Helsinki and the Nuremberg Code, there is no requirement for an ethical review board. You see, yes, if you see a research study and there's no ethical review of it, it's never been through a review board, you would say, what an outrageous scientific study. We can't possibly publish data from such a study. It wasn't even ethically reviewed. What type of unethical scientific behavior could be going on, including knowing that children had signs of malnutrition and doing absolutely nothing about it? The issue, of course, is that what we're doing in the 2000s, which is when this publication was reviewed, is that we're applying the Belmont Report standards to research that was conducted before the Belmont Report came out in 1974. So, you can look at this and say, to what extent, this shifting ground of ethical standards, we're doing research now which perhaps in the future may be viewed as unethical because ethical standards become more refined and sophisticated over time. How in the future are we going to deal with that? By the way, when we sent our response letter saying, first of all, children with malnutrition were referred for treatment, the response of the board was this. In response to your letter appealing the journal name decision not to pursue the above manuscript, I presented your letter at a manuscript meeting of the journal editors chaired by Dr. So-and-so. The group's decision was to stay with our previous determination regarding the manuscript. Yours sincerely. That was the end of it. Very brief, 2-lined letter. Now, a number of issues come up here. Let me turn to the first one, and it's this. That if we accuse scientists of being unethical in their research, shouldn't we be giving reasons in making an ethical decision involving their research? What I'm trying to say is that wasn't it incumbent on the board of those editors, once they had branded us as being unethical scientists by not abiding to ethical principles, when we give a response, aren't we at least due some response back? A reason why, for example, they're not changing their decision. What are the reasons for an ethical decision? I think we're all due that. So there's a question here of due process, but it goes beyond that, I think. Because the issue here is, how are we going to best deal with ethical standards that inevitably are going to change over time? Do we apply our current standards today to research, longitudinal research, that was conducted prior to the time of that ethical mindset, which now determines ethical codes of conduct in research? On the other hand, can we justify publishing research that today we would actually not review as ethical? To some extent, I can totally understand the editorial board's decision at one level. And if we're not going to publish research that unfortunately has lost ground on the prevailing times of ethical decision-making, then how are we going to conduct longitudinal research in the future, research which tries to look for the early causes of both medical and psychiatric conditions in the future, which inevitably span 20 or 30 years? So these are some of the issues that come to my mind, at least, when I consider ethical questions in longitudinal research. The last topic I want to turn to is bringing neurocriminology into law courts. And I've alluded to this at the very beginning of the talk. It goes to the issue of what is neuroscience telling us about concepts, time immemorial concepts of responsibility for our actions, of punishment when we do wrongful acts, and the issue of free will and the extent to which free will really is free. So this is the question coming to my mind when I look at the interface between, on the one hand, neuroethics, neurolaw, and neurocriminology. This is the key question that comes to my mind. If these neurobiological impairments predispose to antisocial behaviour, especially if they come early in life, as I've tried to suggest to some extent, then are criminals truly responsible for their actions? If not, what does this mean? And how are we going to process this ethically, morally, in courts of law? The statement that stands out in my mind that really encapsulates this issue is a statement made by Martha Farrer in this article on neuroethics, the practical and the philosophical. Martha Farrer talks about the case of Phineas Gage. Back in, I think, about 1860, this railway worker Phineas Gage had a tamping rod, a metal rod, blown through his frontal cortex, destroying the frontal cortex and rendering him into a pseudo-psychopathic individual, impulsive, garrulous, sexually promiscuous, gambling, in other words, a very antisocial individual. The damage being to that part of the brain that I've shown you at the beginning of this talk, we find in murderers, poor functioning in the frontal cortex, and also structural impairment to the frontal cortex in individuals with antisocial personality disorder. What Martha says is this: okay, we're not inclined to blame Gage for his bad behaviour. Come on, give him a break. He had the 33-foot long iron bar zip through his prefrontal cortex. Okay, so, you know, he pushes the rules of society a little bit afterwards, but can't we give him a break after that horrendous accident? But the challenge becomes, you know, where are we going to draw this principal line between the causes of bad behaviour in someone like Phineas Gage and the type of bad behaviour in the temporary employment agency chaps that I alluded to earlier? That's the line in the sand question that Farah draws. And the question is, what side of that line are we willing or feel morally justified in standing on? Let me give you a very quick case study to try and make this a little bit concrete. I'll try and give you the two sides or the two perspectives on this case. Peyton Tuttle was this wonderful young woman. She was a cheerleader, she was an athlete, she was a sorority president at her college. She mentored children from poor homes. She organised 5 children to be adopted. She worked with minority children. She left university and then went to Denver and went for an interview with the Cystic Fibrosis Foundation. This was in the middle of the day. She came back to her house and she found a burglar in her house. This was a man called Donta Page that had seen her leave. He went into the home to burglarize it. He spent too long in there. She came back. She was raped and murdered on February the 24th in 1999. What happened is that Donta Page saw her at the top of the stairs. We know her face was punched, we believe, several times. We know this from the confession of Donta Page. He confessed to this awful, terrible crime. She's warding off her attacker with her walls. We know forensically there's blood splattered on the walls, the railings and the floor. He takes her into a bedroom. He ties her hands behind her back and demands, where's the money? He has a knife in his hand. She says the money is in the car. He leaves the apartment. He goes to the car for the money. In the meantime, she has freed herself of her bonds. She's trying to get out of the house. She's running down the stairs. Donta Page comes back into the house, catches her again, takes her back into the bedroom, tears off her blouse and clothes, and he rapes her anally and vaginally. Apparently there's blood everywhere. She's screaming on the bed. He can't stand screaming. That sound, for whatever reason, transforms him. And he slides her to the side of the bed. He takes the kitchen knife and he plunges it twice into her chest. He slashes her throat. There's blood gushing everywhere, but this courageous young woman is fighting for her life. She's standing up. She's still struggling. She has terrible cuts on her hands. There's severing of the webbing of her fingers where she's trying to defend herself against the kitchen knife. He puts 2 more stab wounds into her, one of which is an 8-inch wound severing major heart vessels. She staggers 2 to 3 steps, apparently collapses, and the coroner testifies it probably took about a minute for this wonderful young woman to die. And if you're on the jury hearing this, it's gut-wrenching. And to think of a man who could do this to this wonderful young woman is outrageous. You know, she wasn't killed, she was slaughtered by this man. An eye for an eye, a tooth for a tooth. We need a pound of flesh here. You can understand how jurors think. And I have to say that jurors will be presented with this far more graphically than I've presented to you. So this is one side of the moral, legal, ethical equation that is an eye for an eye. There is an issue of responsibility here. This is one side of the coin, and this is the side of the coin that will justify the death penalty and also severe punishment of offenders, violent, especially homicidal offenders. I want to give you another side to this ethical coin. And the side of this coin is a neurobiological side to the coin. What we did is we had Donta Page brought from Colorado. We had him brought over state lines to have him scanned in the same brain scanner that we scanned those 41 murderers that I showed you earlier. And on the left is his brain scan. On the right is the brain scan of a normal control, and in this top part you're looking head on at the brain, and you stoop down looking up at the brain. You're facing the individual. So this is their forehead here. The red colours indicate high glucose metabolism, good brain functioning. If you look at the normal controls, you see a lot of red. Good functioning in the middle prefrontal cortex. Remember, that's one of those areas that's activated in moral decision-making tasks, as well as the orbital frontal cortex that's critically involved in regulating the amygdala. But in Dr. Page, we see a distinct lack of that prefrontal regulatory activation. And if we do a transverse cut where you're slicing this way through the brain, now you've got a bird's eye view looking down on the brain. This is the front and the back of the brain. You can see a distinct lack of prefrontal activation in the brain of Dr. Page compared to the normal control group. So the defense team, including myself, present this at court. And what we do is we combine the biological with the social risk factors to paint a picture of how this man got to where he was in life. Because it's easy to condemn and convict. Is the ethical, moral question, shouldn't we be doing a much better job in trying to understand not did he do it, but why did he do it? The why question. So this is what we came up with based on hospital records, other testimony. We know that Dr. Page, in the first 2 years of life, was admitted to an emergency hospital. Accidents and injuries, but very likely physical abuse from the mother and other people. We know from the grandmother that he was vigorously shaken during infancy. Why? Because he cried. Now, if you vigorously shake an infant repeatedly, you will lacerate the white nerve fibers that link the prefrontal cortex to the deeper limbic brain areas that give rise to aggressive behaviour, effectively a prefrontal leucotomy. And it's paradoxical that Dr. Page could not stand the screaming of his victim. We know he suffered severe repeated physical and sexual abuse early in life. At the age of 10, he was taken to the hospital for rectal bleeding. You don't have to be a doctor to know what's causing rectal bleeding. He was being raped by the neighbour across the road, and he's being released from hospital to be raped again and again and again by that neighbour. We see the signs of the physical abuse, the scars on his back, a 6-inch scar on the your back. You can't inflict that yourself. Everywhere he had these scars and these burns on his arms, permanent burns. We know it was documented he ate paint debris. Old paint debris has lead. Lead is neurotoxic. That's another hit on the brain. He had no supervision at all. There was no father in the house at all. His mother was very abusive. Rather than sleep in the same house as her, he preferred, as a growing child, to sleep in abandoned buildings. He was raised in one of the worst ghettos in the United States. He was enuretic and encripetic until the age of 10. In other words, he had no bladder and bowel control until 10 years of age. Clearly there's something wrong with this kid. The signs are there early in life. His grandmother documents this kid was severely depressed even at age 6, had ADHD. Teachers' reports document he was severely disturbed right at the get-go. First grade, second grade, he was out of it. He had all the signs of what may appear to be childhood depression. He was referred 8 times in school for some intervention. He never received it. I took his pulse rate 60 beats a minute. A lot of other research showing that low heart rate is a risk factor for later violence. Puts him in the bottom 3%. He fits that checkbox. And certainly the brain scan, as well as neuropsychological test data, documented he had poor frontal lobe functioning. So putting it together, teenage pregnancy, maternal neglect and abuse, head trauma, lack of supervision, poor frontal lobe functioning as indicated by the PET scan, low physiological arousal. You know, this is a walking recipe for violence. All the boxes are basically checked. Now, in the guilt phase of his trial, Dr. Page was convicted of first-degree deliberate murder. In Colorado, it then goes to a 3-person judge panel to decide death penalty versus life imprisonment. This is the letter from Dr. Page that he read out, that was read out at court. You know, Dr. likes to walk in the park. I like to go fishing, watch birds. Sounds crazy, but that's me. But all you see here is a black man that killed a white woman. Nobody cares until I hurt someone. That's the only time anyone has ever tried to help me. I've never had a chance, and now it's all over. And I think in many ways, everything that Dr. Page said is probably true. What was the outcome then? Well, the three-judge panel bought the biosocial arguments of all the social risk factors combined with the brain impairments as predisposing this individual in part to doing the albeit horrific acts that he perpetrated. So instead of being given the death penalty, he was given life in prison. But is that the right decision to be made in this case? We have to think of legal perspectives on punishment here, and the punishment side is, but we need retribution. This man should be blamed. There's a just deserts principle that we should abide to. We need deterrence. We need the death penalty to deter others like him. We need to protect society. Incapacitation is critical. Also, we need to rehabilitate. Those are some of the principles that, will determine, the severity of a punishment. And we have to respect the law and these principles, which are the foundation of law. But I think what we get into this case is that ethical and moral and even philosophical issue of biological determinism versus free will. Was that judgment the correct judgment in this case? Because you could counter and say, look, if you take the proposition that there are these early predispositions that predispose to later violence, then where does this end? Where's the line in the sand? Isn't all behaviour determined? And if so, none of us are responsible for our actions. Where goes then the concept of responsibility which keeps our society intact? That's a reason not to go with the decision of that three-judge panel, nor my testimony in the court. The other question it raises are the degrees of free will. We tend to think of free will as black and white, but are there shades of grey in the degree to which we have free will? Isn't it the case that for some people, like Donta Page, the dice are loaded early in life for reasons beyond your control? Because he was not responsible for the abuse he received. He was not responsible for the poor prefrontal functioning. He was not responsible for the lack of bonding with the parent who was never there. Did he have free will? And to the extent to which individuals have a reduction in freedom of will, shouldn't we appropriately be reducing their punishment? And here's the problem though, going down this slippery slope, but if you begin to buy into this type of argument, if we accept that there are significant constraints on some people's freedom of will, then morally, ethically, the ethical question is it wrong to punish prisoners? And I'm not just talking about the death penalty, because some of you in this room may not agree with the death penalty for ethical reasons, but what about life imprisonment that we give to offenders without the possibility of parole? Is that morally justified? Is that ethical? Given what we are beginning to learn about the neuroscientific and psychosocial bases of crime and violence. And where is that ultimately going to lead us to? Let me just finally, briefly summarize three key questions that in my reflection come out of what I'm saying, and there may well be more issues. But the first question that arises is this, scientifically, will neurocriminology be able to increase our ability to predict crime? And if so, the ethical moral question becomes, how far away is a minority report society where we start to detain people, lock them up before they have done any wrong in society? The second ethical question here, comes to the ethical question in research of how are we going to appropriately deal with the shifting sands of ethical judgments that occur over time, and the fact that some science is predicated on longitudinal research studies that take place over a 20, 30, even 40-year period, which become ethically outdated given current ethical standards. That's the second key ethical question that I want to pose to you. And the third ethical question, perhaps glibly summarized in the statement, is it wrong to punish prisoners, is the extent to which we need to increasingly take into account neurobiological risk factors that increase the odds of an individual committing horrific, albeit acts. Should they be punished as severely as we do punish them? To what extent are we being ethically wrong in treating prisoners in the way that we do? Remember that we currently conduct passive eugenics on prisoners. In many states of America, we do not allow prisoners to reproduce. They're not allowed to send sperm out of the prison. Female prisoners are not allowed to receive sperm. My understanding is that that is eugenics. We're stopping them reproducing. It's a passive eugenics because we're not castrating them, we're not killing them. But isn't it nevertheless eugenics? So ethically, let us factor that issue into the extent to which we punish prisoners in the way that we do. Thank you very much indeed for your attention today.